Everyone. Today I will be discussing an important topic which is shaping and cleaning of the radicular space. Endodontic treatment can be divided into three phases: proper access preparation into the pulp space, shaping and cleaning of the root canal. Third one is obturation. What is shaping and cleaning of the root canal? It consists of removing the pulp tissue and debris from the canal and shaping the canal to receive an obturating material. What is pulpectomy, which is also called devitalization? It is a complete removal of normal or diseased pulp from the pulp cavity of the tooth. What is debridement? When food or other debris have accumulated in the pulp cavity in addition to the residual necrotic pulpal debris, the removal of this material from the pulp cavity is referred to as debridement. Schilder's objectives of shaping and cleaning of the root canal system should have a continuous tapering conical shape with the narrowest cross-sectional diameter as apically and widest diameter coronally. The wall should taper evenly towards the apex. To give the prepared root canal the quality of flow, that is a shape that permits plasticized gutta percha to flow against the wall without impedance. Should keep the apical foramen as small as practical, should shape and clean the canal without transporting the apical foramen. But are the biological objectives? Confinement of instrumentation to the root themselves, ensuring that necrotic debris are not forced beyond the foramen, removal of all tissue from the root canal space, creation of sufficient space for the optimal obturation of the radicular space. What are the goals of shaping of the radicular space? Root canal should be widened for four reasons: to eliminate microorganisms, to completely remove pulp tissue because later on it undergo necrosis and provide an environment for bacterial growth, to increase the capacity of the root canal to permit irrigation solution to reach the apical third of effective disinfection, to shape the root canal to receive gutta percha. What are the components of an endodontic file? Taper. Taper denotes the per millimeter increase in file diameter from the tip towards the file handle. Taper instrument help in preparing canal of wider diameter without overlarging the canal at working length. Tip design. Original stainless steel root canal instrument usually possesses a sharp cutting tip. Rotatory instruments currently are manufactured with modified non-cutting tips, as these non-cutting tips cause less canal transportation and remove debris better than traditional instrument. What is flute? It is a groove or a relief on the working surface of the file which collect the debris as the file cuts through the substrate. What is chip space? Chip space denotes improved ability to remove debris out of the root canal. Cutting edge, which is called blade, it is the working area of the file and is the surface with the greatest diameter that follows the flute as it rotates. What is pitch? It is the distance from one cutting edge to the next. A file with short pitch will have more spirals than a file with the longer pitch. Rake angle. Rake angle is formed between the cutting edge, which is called blade, of an endodontic file and the radius of the instrument, which is a line passing from the center to the cutting edge. Types of rake angle: positive rake angle, cutting edge is ahead of the radius. More aggressive cutting, faster dentin removal. Example: some rotary night eye instruments. Neutral rake angle, cutting edge is exactly on the radius. If an obtuse angle is formed, then rake angle is positive. An acute angle is termed negative rake angle. Helix angle, it is the angle the cutting edge forms with the long axis of the file. Classification of endodontic shaping. Instrument based on the method of use. Group 1, hand operated endodontic instrument. First one is barbed broach. Broaches were the earliest endodontic instrument used to extirpate the pulp and enlarge the canal. Barbed broach is used for the extirpation of the entire pulp and for the removal of necrotic debris, cotton, and other foreign material from the root canal. It is manufactured from a tapered round soft iron wire. The selection of the suitable sized broach for the removal of the pulp and gross debridement is important. A barbed broach that is too wide does not permit removal of all pulp tissue, or it may force the pulp apically as it is inserted into the canal. It may also bind in the canal as it rotates and may thereby break. On the other hand, if the broach is too narrow, it will not engage the pulp tissue sufficiently to allow its removal. Brooches were originally recommended to be used in the straight part of the root canals and are not inserted into the root canal until the canal has been enlarged throughout up to a size number 20 or 25 reamer or file. This precaution prevents accidental breakage of the brooches inside the canal. Brooches break easily, especially if they bind in the root canal. To avoid binding and breakage, many clinicians avoid the use of brooches and initiate root canal exploration and instrumentation with 1086 sized K file. Next one is K-type reamer and files. K-type endodontic instruments is used to improve the efficiency of root canal preparation. Originally manufactured from round taper piano wire, the stainless steel wire is ground along its long axis into a four-sided square cross-sectional or three-sided triangle cross-sectional tapered shaft that is twisted into flute extending 16 mm from the top to the tip of the cutting blade. The introduction of the nickel titanium alloy for manufacturing endodontic instrument has improved canal shaping due to its improved flexibility and compared to stainless steel. Reamer manufactured from a triangular blank and file manufactured from a square blank are still made by a few companies. Clinically, files and reamer are recommended to be used in penetration, rotation, and retraction motion. File can also be employed in filling or a rasping motion once canal patency is achieved. Files are manufactured from blank twisted to produce tighter flutes, and reamer are manufactured with looser flutes. As the use of the square blank result in instruments that resist fracture more effectively than those made from the triangular blank are generally used for smaller fragile instruments. When instrument fracture is no longer a critical factor, such as in larger instrument, triangular blank can be used. Difference between K-file and K-reamer. K-file have more fluids than K-reamer. Spiral is tight in K-file. Motion is filling plus reaming. In K-reamer, it is only reaming motion. K-file is more flexible. It has less aggressive cutting action. Modification. K-flex file. Rhomboidal or diamond-shaped blanks have been twisted to produce a file called K-flex. This design increased the flexibility and cutting efficiency of the instrument. Next one is flexar file, a stainless steel file. A reduction in the cutting tip angles make the file stay more centered within the canal and enables a more circumferential cutting edge. This modified tip file is called flex R file. Next one is headstone file, which is called H file, as manufactured from round stainless steel wire machined to produce spiral fluids resembling cones or screws. This instrument has been a higher cutting efficiency than K instrument, but it is fragile and easily fractured. Modification of H file. Safety headstone. It is a H file with a non-cutting side in order to prevent ledging in the curved canals. High flex file. Present as S shape instead of a traditional single helix teardrop cross-sectional of the headstone file. Unifiles, they are machined from the round stainless steel wire by cutting two superficial grooves to produce fluids in a double helix design. They resemble the H file in appearance and are less subjected to fracture. S file, it has double helix cross-sectional and is a variation of unifile. Stainless steel and nickel titanium root canal instruments have been replaced with carbon steel instruments because they are more flexible and therefore less likely to fracture. Group 2 is low speed stainless steel instruments with latch type attachment. The most commonly used low speed rotatory stainless steel instrument in endodontic is Gates Glidden drills and piezo reamer. Gates Glidden drill has long thin shaft ending in a flame shaped head with a safe tip to the guard against perforation. The flame head cuts laterally and is used with a gentle apically directed pressure. If the drill binds during use, it will fracture at the neck of the shaft and will extrude from the tooth. Drux burrs are designed similar to the Gates Glidden drill but have a flexible shaft. The Gates Glidden drill is used to remove the lingual shoulder during access preparation of the interior teeth and enlarge root canal orifices. Piezo reamer has a long sharp flutes connected to a thick shaft. It cuts laterally and is primarily used for the preparation of the pores space when gutta percha has to be removed from the obturated root canal. Both Gates Glidden drill and piezo reamer are made up of stainless steel and are used with an electric slow speed handpiece in a rotational speed ranging of 800 to 1200 rpm. Next one is Group 3 ultrasonic and sonic instrument. Both the sonic and ultrasonic instruments have been reported to cause transportation of the canal if used carelessly. Currently, both sonic and ultrasonic devices are not indicated for shaping of the canal. It is more indicated for cleaning application inside the root canal. Group 4 is engine driven nickel titanium instrument, most commonly used rotatory endodontic instrumentation, which is nickel titanium. This alloy consists of 55% of nickel, 45% of titanium by weight. The superelastic alloy does not exhibit proportional strain under stress. This unique property is due to the authentic crystalline structure of the alloy. What is reciprocating instrument? It is a technique in which a file moves in an alternative clockwise and counterclockwise motion instead of continuous motion. It is used to reduce stress on the instrument. What is canal adaptive endodontic instrumentation? It works on principle. In low stress, file rotates in continuous motion. In high stress, it switches to reciprocating motion. This adaptive motion reduces instrument fatigue and fracture. What is SAF, which is self-adapting file? A file is a hollow, flexible nickel titanium mesh-like file that adapts three-dimensionally to the canal shape and allows simultaneous irrigation and cleaning. It works on a principle, works with vibratory motion. File expand to touch canal wall, continuous irrigation and result in uniform dente removal and effective cleaning. SAF system is no longer commercially available. Next one is XP Endo Finisher, which is used to maintain original canal anatomy. It adapts to the irregular canal. It reduces fracture risk, efficient in curved canal. Guidelines for shaping of a root canal. The tooth to undergo root canal therapy is identified by penetrating the enamel at the site of the access cavity. The rubber dam is applied. The tooth clamp and rubber dam are scrubbed with the sterile cotton tip application. The access preparation is completed in posterior teeth. After complete removal of the roof of the pulp chamber, the coronal pulp is removed with a sharp endodontic spoon excavator. The chamber is irrigated with 5.2% solution of sodium hypochlorite and is dried with suction. Next, the canal orifices are located by probing with endodontic explorer along the anatomical groove located in the chamber floor leading to the root canals. These anatomical grooves, sometimes called dentinal map. The shaping process of the root canal can be broadly classified into phase 1, which is glide path determination, phase 2, coronal pre-enlargement, which is orifice enlargement, working length measurement, root canal shaping technique, root canal working width. First one is glide path determination, which is called canal patency. The concept of creating a patent path up to the working length without altering or blocking the original root canal anatomy is known as glide path determination or canal patency. In easy word, canal patency is a procedure of keeping the apical portion of the root canal free of debris by gentle passing a small file slightly beyond the apical foramen. Uses a small K file Pass it 0.5 to 1 mm beyond working length. Done gently between. The glide path is established by using a 10 number or 8 size stainless steel K file in a reaming motion. These files, hence it is called patency files. These help in maintaining a continuous and clear path for the canal orifices to the apical foramen by removing debris, especially when combined with irrigation. Rotatory glide path instruments. Certain designed instruments like nickel titanium rotatory instrument aid in establish the gliding path and are used in conjugation with stainless steel 10 and smaller K file. For example, pro glider files. A blocked orifice can be opened by picking out the calcified tissue with a sharp endodontic explorer or by removing the blockage using slow speed, small, round bursts. If the procedure is not successful, chelating agent EDTA is used. Phase 2 is coronal pre-enlargement, which is orifices enlargement. It is a concept of enlarging the coronal third of the root canal prior to the estimation of working length. The working length of the tooth should be determined only after this procedure is completed. This concept of coronal pre-enlargement is recommended for the following reasons. Root canal have multiplanar curvatures that increase the stresses on shaping instrument as they proceed apically. Enlarging the orifices and 2 to 3 mm of coronal third reduce the stresses on shaping instruments. The coronal third of the root canal contains the maximum pulp tissue, and enlarging this space reduces the amount of the periapical debris during shaping procedure. Coronal pre-enlargement is achieved with the help of orifices enlargement or with Gates-Glidden drill.